Maternal Newborn Fetal Monitoring Review Quiz with answers. Question 1. The woman with the lowest risk for sexually trans. Option A. Red swollen area around distal suture repair of mid-pelvic inflammatory disease is one who uses episiotomy site. Which of the following? Option B. Oral contraceptives. Option C. A barrier method of contraception. Option D. An intrauterine device for contraception. The correct answer is option C. A barrier method of contraception. The lowest risk for sexually transmitted pelvic inflammatory disease is associated with using a barrier method of contraception, such as condoms. Question 2. A nurse is admitting a client who is at 33 weeks of gestation and has preeclampsia with severe features. Which of the following actions should the nurse take? Option A. Restrict protein intake to less than 40 g/day. Option B. Initiate seizure precautions for the client. Option C. Initiate an infusion of 0.9% sodium chloride at 150 ml/hr. Option D. Encourage the client to ambulate twice per day. The correct answer is option B. Initiate seizure precautions for the client. In a client with preeclampsia with severe features at 33 weeks of gestation, initiating seizure precautions is a priority nursing action. Question 3. A 29-year-old low-risk primiparous patient has just placental abruption? Option A. Mild grade 1. Option B. Moderate grade 2. Option C. Marked grade 3. Option D. Severe grade 4. The correct answer is option B. Moderate grade 2. Placental abruption is classified based on the severity of symptoms and extent of separation of the placenta from the uterine wall. Question 4. A nurse is educating a prenatal client on pregnancy 140 to 90 bpm that begins with the contraction changes and her gastrointestinal system. Which and gradually returns to the normal baseline statement is correct? Option A. Because of increased saliva production during related to pregnancy, the client should use a medium to hard. Option B. Uteroplacental insufficiency toothbrush to prevent plaque. Option C. Umbilical cord compression. Option D. Heartburn may be relieved by sitting up after. The correct answer is option D. Heartburn may be relieved by sitting up after. Heartburn may be relieved by sitting up after. Question 5. Which of the following is an abnormal finding upon? Option A. To monitor hydration status physical examination of an infant. Option B. To reduce the risk of bladder injury. Option C. Anterior fontanelle that has a diamond-shaped open. Option D. To prevent the patient from urinating during space surgery. The correct answer is option D. To prevent the patient from urinating during space surgery. The abnormal finding listed in option D, to prevent the patient from urinating during space surgery, stands out from the rest of the options provided. Question 6. A patient is about to undergo an amniocentesis. Should on her postpartum clients. Which client has a which procedures should the nurse perform? Select high risk for postpartum hemorrhage. Select all that apply. Option A. Have the patient give verbal consent for the. Option B. Client who delivered vaginally at 40 weeks procedure. Option C. Client who delivered by cesarean delivery because. Option D. Assess for bleeding disorders. The correct answer is option A. Have the patient give verbal consent for the. In this scenario, option A is the correct answer as having the patient give verbal consent for the procedure is a crucial step before conducting an amniocentesis. Question 7. Which environment can assist a pregnant teen to achieve the task of establishing a stable identity? Option A. Homeschooling. Option B. Alternative education program. Option C. School-based mothers program. Option D. Continuing mainstream high school classes. The correct answer is option C. School-based mothers program. A school-based mothers program can assist a pregnant teen in establishing a stable identity by providing specialized support and resources tailored to their unique needs. Question 8. Which statement by the patient helps the nurse know? Option A. Follicle-stimulating hormone. She understands the teaching about condom use. Option B. Gonadotropin-releasing hormone. Option C. A condom can be worn for 2 sexual encounters. Option D. Progesterone as long as it does not break. The correct answer is option A. Follicle-stimulating hormone. She understands the teaching about condom use. The statement condoms come in different sizes. It is important I get the right size to ensure proper protection indicates that the patient understands the teaching about. Question 9. Which of the following is an example of healthy grieving? Option A. The mother exhibits an absence of crying or expression of feelings. Option B. The parents do not mention the baby in conversation with family members. Option C. The mother asks that the baby be taken away from the delivery area quickly. Option D. While holding the baby, the mother says to her husband, "He has your eyes and nose." The correct answer is option D. While holding the baby, the mother says to her husband, "He has your eyes and nose." While holding the baby, the mother saying to her husband, "He has your eyes and nose," is an example of healthy grieving. Question 10. A nurse is assessing a newborn who is 48 hours old and has a maternal history of methadone use during pregnancy. Which of the following manifestations should the nurse identify as an indication of neonatal abstinence syndrome? Option A. Hyporeactivity. Option B. Excessive high-pitched cry. Option C. Acrocyanosis. Option D. Respiratory rate of 50/min. The correct answer is option B. Excessive high-pitched cry. Neonatal abstinence syndrome, NAS, occurs in newborns who were exposed to substances, such as methadone, while in the womb. Question 11. Which health concern is most likely to be an issue for the older mother? Option A. Nutrition and diet planning. Option B. Exercise and fitness. Option C. Having enough rest and sleep. Option D. Effective contraceptive methods. The correct answer is option A. Nutrition and diet planning. As women age, their nutritional needs may change, and they may require more specific nutrients to support their health. Question 12. A nurse is performing a vaginal exam on a client who is in active labor. The nurse notes the umbilical cord protruding through the cervix. Which of the following actions should the nurse take? Option A. Administer oxytocin to the client via intravenous infusion. Option B. Apply oxygen at 2L/min via nasal cannula. Option C. Prepare for insertion of an intrauterine pressure catheter. Option D. Assist the client into the knee-chest position. The correct answer is option D. Assist the client into the knee-chest position. Assist the client into the knee-chest position. Question 13. A patient who was diagnosed prenatally as having epidural for pain management. What should the greater than 2000 ml of amniotic fluid just deliver nurse be prepared to do? Select all that apply. Air to 9 pounds, 4082 g, baby girl. Her nurse is aware. Option A. Assess maternal vital signs that she is now at risk for which condition? Option B. Assess FHR. Option C. Infection. Option D. Assist patient to the bathroom to void. The correct answer is option A. Assess maternal vital signs that she is now at risk for which condition? A. Assess maternal vital signs with the delivery of a baby with macrosomia, greater than 4000 g. The mother is at risk for postpartum hemorrhage due to uterine atony. Question 14. A nurse is caring for a client who is in the transition phase of labor. Which of the following? Option A. Assist the client to void every 3 HR. Option B. Monitor contractions every 30 minutes. Option C. Place the client into a lithotomy position. Option D. Encourage the client to use a pant-blow breathing pattern. The correct answer is option B. Monitor contractions every 30 minutes. Monitor contractions every 30 minutes. During the transition phase of labor, contractions are typically intense and frequent. Question 15. Which of the following conditions is concerning to the nurse recognizes which as a risk factor for placenta the infant nursery nurse? Abruptio? Select all that apply. Option A. An infant who passes a thick, greenish to black. Option B. Use of alcohol stool with each bowel movement. Option C. Hypertension. Option D. Hard, small, white papules on the face of the. The correct answer is option C. Hypertension. Correct answer C. Hypertension. Rationale 1. Question 16. A newborn is suspected of having substance abuse instructions. Exposure. Which of the following assessment findings? Option A. Exercise will decrease my metabolism and should the nurse expect? Select all that apply. Option B. Increased weight gain. Option C. Starting on glucophage will take the place of. Option D. Seizures. The correct answer is option D. Seizures. Seizures. Substance abuse exposure in a newborn can lead to withdrawal symptoms, including seizures. Question 17. Which of the following should be implemented in is experiencing increased oral mucus should provide management of hypovolemic shock due to postparent education on which of the following? Tum hemorrhage? Select all that apply. Option A. Correctly positioning the infant for feedings. Option B. For fluid replacement with 5% dextrose. Option C. Initiating cardiopulmonary resuscitation. Option D. Administration of oxygen with a non-rebreather. The correct answer is option A. Correctly positioning the infant for feedings. Correctly positioning the infant for feedings. Question 18. The nurse is educating a prenatal client about weight dysphoric disorder. Which statement by the client gained during pregnancy? Which statement by the would require immediate follow-up? Client indicates effective understanding. Option A. I have been crying the week of my period. Option B. I should gain 2 to 4 pounds in the first trimester. Option C. I am experiencing suicidal thoughts, and half a pound per week in the last 2. Option D. My menstrual cycle is 1 week late. Trimesters. The correct answer is option C. I am experiencing suicidal thoughts, and half a pound per week in the last 2. Correct answer C. I am experiencing suicidal thoughts. Rationale: this statement indicates a serious mental health concern that requires immediate follow-up. Question 19. Which complication of adolescent pregnancy should the nurse plan to monitor? Option A. Anemia. Option B. Placenta previa. Option C. Abruptio placenta. Option D. Incompetent cervix. The correct answer is option D. Incompetent cervix. Incompetent cervix, also known as cervical insufficiency, is a condition where the cervix begins to dilate and efface prematurely due to weak cervical tissue. Question 20. A nurse is doing genetic counseling with a couple. Get to a client undergoing a mastectomy. The mother has Down syndrome and the father, option A. Tylenol should be avoided after surgery, has no chromosomal abnormalities. What is the? Option B. The affected arm should remain in a sling for chance of their offspring being affected by this 4 weeks. Disorder. Option C. The client should expect the affected arm to be. Option D. 25%. The correct answer is option D. 25%. When a woman with Down syndrome, trisomy 21, has a child with a man who does not have any chromosomal abnormalities, the chance of their offspring having Down syndrome is 25%. Question 21. A patient has delivered twins. The first twin was stillborn, and the second is in the intensive care nursery, recovering quickly from respiratory distress. The patient is crying softly and says, "Wish my baby could have lived." What is the most therapeutic response? Option A. How soon do you plan to have another baby? Option B. Don't be sad. At least you have one healthy baby. Option C. Have a friend who lost a twin and she's doing just fine now. Option D. I'm so sorry about your loss. Would you like to talk about it? The correct answer is option D. I'm so sorry about your loss. Would you like to talk about it? Because it shows empathy, acknowledges the patient's loss, and invites further discussion if the patient wishes to talk. Question 22. A nurse is caring for a client who is receiving oxytocin to augment labor. The nurse notes recurrent variable decelerations. Which of the following actions should the nurse take first? Option A. Prepare the equipment necessary to initiate an amnio infusion. Option B. Administer oxygen at 10 L/min via non-rebreather face mask. Option C. Discontinue the infusion of oxytocin. Option D. Place the client in a left lateral position. The correct answer is option C. Discontinue the infusion of oxytocin. Recurrent variable decelerations during labor can indicate umbilical cord compression, which can result in fetal hypoxia and distress. Question 23. Which is the most dangerous effect on the fetus of a patient who smokes cigarettes while pregnant? Option A. Intrauterine growth restriction. Option B. Genetic changes and anomalies. Option C. Extensive central nervous system damage. Option D. Fetal addiction to the substance inhaled. The correct answer is option A. Intrauterine growth restriction. Smoking cigarettes during pregnancy is known to have harmful effects on the fetus, with one of the most serious consequences being intrauterine growth restriction, IUGR. Question 24. A nurse is providing dietary teaching for a client who is at 29 weeks of gestation and has phenylketonuria. Which of the following suggested foods should the nurse include in the teaching? Option A. A peanut butter sandwich on wheat bread. Option B. A sliced apple and red grapes. Option C. A chocolate chip cookie with a glass of skim milk. Option D. A scrambled egg with cheddar cheese. The correct answer is option B. A sliced apple and red grapes. Phenylketonuria, PKU, is a genetic disorder where the body cannot metabolize phenylalanine, an amino acid found in protein-containing foods. Question 25. A nurse on the labor and delivery unit is assessing 4 clients. Which of the following clients is a candidate for an induction of labor with misoprostol? Option A. A client who has active genital herpes. Option B. A client who has gestational diabetes mellitus. Option C. A client who has a previous uterine incision. Option D. A client who has placenta previa. The correct answer is option C. A client who has a previous uterine incision. Misoprostol is a prostaglandin E1 analog that is commonly used for labor induction.